Hello, I'm Chiche, and I presently direct the Center for Aesthetics and Implant Dentistry at Georgia Regents University in Augusta. So let me share with you a little clinical tip that I discovered one day by coincidence. And let's say that you are bonding porcelain veneers, and from what I've seen with all the groups and most of the practitioners that I talk to, we all like to seat our veneers and clean the excess cement as we go. And at one point we are going to tack cure the veneers so we can floss the proximal cement from the interproximal aspect. That's really the best time to get that interproximal cement off. Well, in a perfect world, we would like to have the gingival tissues perfectly healthy. We know that. But there are many situations where the interdental papilla may be slightly irritated and there may be some inflammation that comes from the provisionals or maybe some slight overhangs in the tissues. What I've noticed is if there's going to be some bleeding during the bonding procedure, it'll be right when you floss in the interproximal and suddenly blood comes and oozes out. And that can happen even though you may have a cord packed during the bonding procedure. So what we found is that when we floss the proximal cement off, we have ready to be used right on the bracket table a heavy glycerin gel. If you want a brand name, for example, one of them was called Heavy Train Glycerin Gel by Cosmedent, and I think they changed the name to Oxygon. But again, it's a heavy glycerin gel. You don't want it to be watery. And what we noticed is that as soon as the bleeding occurs, we simply syringe in the glycerin gel with pressure in the site, and what it does, it encapsulates the blood. It's not a hemostatic agent, it's more like a colloid that has such a viscosity that the blood stops flowing, number one. It encapsulates the blood, and the good thing is you keep flossing. You see, you have kind of stopped, you have frozen the process. It works so well that we decided with our aesthetic team to have this glycerin gel available every time we bond restorations. So you floss, and then you finish your work, and then you can do your final cure pretty much on your own time. Now, what may happen also sometime, if you really have inflammation, you floss again, you try to finish your job, and it bleeds again. Fine. Don't panic, just grab your glycerin gel, just press. You will see again the blood, the droplet that will be encapsulated once again, and you'll be able to finish flossing. We do that no more than twice, because then it's time to finish curing your veneers. So try that and see if you like it, and if it works for you, you'll buy me a beer. How's that?